Mentor Program Management. The first page that will appear on the Mentor program will be an introduction to the ArthroSim, and then at the bottom will be a table of contents. The two important items on the bottom are examination of the knee, scope only, and examination of the knee, scope and probe. The next page is the technique page describing how to probe the PCL and ACL. This will be followed by a live video demonstration of a right knee probing the PCL and ACL by Dr. Greg Palutzis with his partner, Dr. Howard Sweeney, narrating. This is done in Chicago.
Now the knee has been brought back into a more neutral position in terms of varus valgus, and the probe is in the intercondylar notch, and the probe is actually lying on the posterior cruciate ligament, and he will put the tip of the probe under that ligament and pull on it. Now he's pulling up on it, and that shows that the posterior cruciate ligament is well attached. Now the probe is on top of the ligamentum mucosum, and we're pulling it to the side, and we'll put the scope in, and you have a little better view of the contents of the intercondylar notch.
Next there will be a quiz on the procedure. Notice that the fourth item is the correct one, which is a well-developed ligamentum mucosum may be mistaken for the ACL. Click that, and you want to see what your score is, so click the score box, and you can see that you passed it. You cannot go to the next page without passing the quiz. So now click on the arrow to advance to the next window, which is the simulator page. This is composed of 4 steps. 4 steps comprise a task. So click the red advance button on the camera, and the first step is activated by the black arrow. Now you have to perform the proper examination of the PCL, starting with palpation of the lateral side of the PCL. If you do that correctly, you get 50%. Now, if one has palpated correctly the medial side of the PCL, then one can obtain 100% score. Click the red button on the camera to advance to the next step. Once one has completed all 4 steps successfully, go to the simulator task. The simulator task will wrap up all the steps into one task. In this case, we're going to examine the medial meniscus. One has to examine the posterior horn, the middle third, and the anterior horn. Those are the 3 steps comprising a task of examination of the medial meniscus. There will be a score report on the left mentor screen, and it will show how you have been doing. It goes from 0 to 21% to 57% to 78%. Now, you didn't get 100%, so in order to see what you've done incorrectly, push the View screen drop-down menu on the left-hand monitor, show Score Report, and over on the right-hand screen is the score report. Notice that one did not adequately probe the inferior and superior surfaces of the middle third of the meniscus. That is why you did not get 100%. Once one gets 100%, then the next step will be going to the timed task. The timed task is like the task, except you have a clock running down so that you can compare your performance to the average of community-based surgeons.